Okay, so one other matter is of equal concern, still bordering on COVID-19, is that of Cross River State. So the NMA, the medical, the Cross River State government, the health community, they're all concerned about developments going on there. So right now we've got Dr. Betta Edu, who is the Commissioner for Health. She joins us via Zoom. Good morning. Thank you for joining us today on the program. Well, yesterday, the news broke that the health workers there have gone on indefinite strike. They're not happy with developments in Cross River State. How do you respond to that?
Okay, first and foremost, not all health workers have gone on strike, but the NMA Cross River State that has gone on strike. And this is the second strike in a pandemic, and it's becoming really very, very embarrassing to the association and indeed to our professional body, who we swore to protect patients. At the point where we have a pandemic and there is a response to put up, one will believe that having brought all of them to the round table as key stakeholders and have supported even their institutions where 90% of them are to be able to respond, having trained them and done a lot of investment in that institution, that we would have NMA Cross River State come out fully to support the state at this time of a pandemic response. Unfortunately, that's not the case. It's been a back and forth. I'm sure you know the journey through the Cross River State COVID-19 response has been a long one. Once you bring out a policy, we started the no mask, no movement policy in Nigeria, and NMA came out to say the no mask, no movement policy was wrong and it was going to endanger people's lives. The mask provides no protection. Every minute you go a step forward, they write a letter, they threaten for strikes and all of that. And it's becoming really just a group of persons who have a platform and they're using it against the people of Cross River State, which of course as a government, we will continue to engage to see that we come back to the round table and do what is right for everyone. Progress on all fronts might not be at its peak, but of course, you know the different challenges that exist, but we'll continue to do our best to see that Cross Riverians are protected and Cross Riverians are given the best of care even during this pandemic.
Let's get across to Dr. Agamayuk, who is the chairman of the NMA in Cross River State. He joins us via Skype as well this morning. Good morning, and thank you for joining us today on the program. All right, well, let's switch back to Dr. Edu then. Well, Dr. Edu, having looked through their press release, part of the reason they just felt that Cross River State's government was not handling some of these cases properly, and they have treated persons who have contracted the virus, and they still wonder why the NCDC hasn't actually given a proper look from their perspective as to giving them a true picture of what is going on in Cross River State. You've seen their messages, haven't you?
Yes, basically I think I would want to start from this point. First, I'm sure you know as early as January, Cross River State government set up the EOC, and we invited both the NMA and indeed all professionals to be on board the emergency operations room so that we can dialogue, we can share ideas, and we can move forward on this response. They are part of the response committee. They're part of the response team. Not just doctors, but all other health workers, military, paramilitary, have been part of this response. We started as early as February to screen people who are coming in through our borders, both the airport, seaport, and the land. We shut our borders quite on time. We started the no mask, no movement, provided over 1.5 million nose masks for Cross Riverians. We provided face shield, PPEs. We have been supporting the University of Calabar Teaching Hospital and indeed doctors with both the N95 face masks and several other items which we have donated to see that this response goes on very well. When it concerns testing, remember that Cross River State is attached to IRUA, which is the lab in Edo State. And with the lockdown at that point, you travel for one full day with a sample to get to Euroa. Sometimes you get to Euroa, they say they don't have reagents. Reagents are finished. You need to wait for 1 or 2 days. And then, of course, before you come back to pick up samples, to get the sample results, and have people travel for another one full day to get back to Calabar. It was a very cumbersome, expensive, difficult process for the state. And we kept saying that we needed the NCDC and others to come in and set up the labs. Remember, the labs cannot be set up by us. They come in and do the training, they come in and do the accreditation and all of that, and then the labs become functional. Okay, in this case, we have people who every single day, they call us, they say, come and see this case. We head down there, pick up samples, we send the samples to the lab. And of course, we try to do contact tracing immediately. We do surveillance around that area to ensure that our people are protected at all times. But then you find them casting doubts on results that come even from the NCDC accredited laboratory to say it does not match what they think. This person had fever, and so if anybody dies of fever at this time, it should be COVID-19. It doesn't match what they think. You will find a patient who is a known asthmatic patient having respiratory distress, and then the next minute they say, oh, it doesn't match the picture. This person died of COVID-19. I've been in a ward, and I saw a patient come in and was abandoned at one end just to die because they suspected that that was the case of COVID-19. Several of these were happening. Now we said, okay, fine. If you find anybody who has suspected cases, please treat the person as COVID-19. The state government will take responsibility for the cost of treatment, treat the person as COVID-19, and will take samples and send to the lab. If the result comes back and the person is not COVID-19 positive, then you can now move the person back to the general labs. Of course, you remember very clearly at the beginning of this intervention, we're given very few sample collection kits. And then, of course, as a state, when we had to go out for surveillance and the rest of them, we needed to get a backup plan to say, okay, can we get an FDA-approved antigen rapid test kits that we can use for surveillance, quick screening, that can at least give us a picture while we go ahead to go search for, go through the long process.
Just hang on a minute. All right, hang on a minute, Dr. Dr. Ayuk, from what she just said now, and perhaps before you even joined up, she stopped short of saying that the NMA is crying wolf where there is none.
Well, thank you very much. For us as an association, we remain committed to the welfare of our members and the public, and the health issues should be taken very seriously, and politics should not be played with the health of the people. Well, we have said that the NCDC have not updated updated the 5 cases that were confirmed from an NCDC accredited laboratory in Abakaliki into their situation report. That result was ready as far back as July 1st. It was transmitted to the hospital, the UCTH, as of July 1st. And I think the Commissioner for Health and His Excellency, the Governor of Cross River State, were given those results on the 2nd. And as we speak, that has not reflected in the NCDC platform. And from what we are being told, the state government has refused to assign state code numbers, epidemiology numbers to those samples that had been analyzed and results sent. And because of that, they cannot update those results into the NCDC platform. For us, we think that it is still part of the plan to remain the deceit in ensuring that the right things are not done. We have gone through a lot to get to where we are. We needed evidence, and a lot had been done. And God willing, NCDC noticed that there was a problem and declared GCTH an independent test center. And that was how they sent in samples, sample collection kits on Sunday, 28th of July. And the first samples from 5 patients, including 2 doctors, were sent on Monday, July 29th. And on Monday, June, the samples collection kits were received on June 28th, And the first samples, 5 samples were sent on June 29th. And on July 1st, the results were transmitted to the ECTH management. And of course, since then, NCDC has refused to update those results in their daily situation report. And we think that something is going wrong. We needed evidence, we have the evidence, and NCDC is refusing to update that. And we are worried. And of course, we can't sit back, because the implication of not updating their data is that the other processes that will follow will not take place. For example, contact tracing will not start. The state government have not activated the isolation center at Adiabo because the excuse is that there is no confirmed case. So those are some of the things that we are carrying foul.
Doctor, just to be clear, yeah? Are you saying that Cross River State has recorded at least 5 cases of COVID-19 so far? And we wonder, what happened to those cases? Were they treated? Have they been discharged? What exactly is the situation of those cases?
The 5 cases which have been confirmed using the PCR test, which is the gold standard for COVID-19 tests, we had 2 patients who were already on admission at the UCTH Isolation Center. We had 1 patient who was billed for ENT surgery, and two patients who were medical doctors who had respiratory symptoms. As we speak, the 2 doctors who I had direct contact with, I said yesterday night I called them, have you been contacted by anybody for contact tracing or anything? And they said no, they are all in their houses on self-isolation. Nobody has done anything. And we are crying aloud and saying that cannot be allowed to continue. We have patients who come to UCTH. UCTH only has capacity of, the isolation unit has 5-bed capacity. And we have patients being turned back because that center was meant for very severe cases that need a lot of attention. And that is not happening. So patients are being turned back. People are dying in their homes. People are being sick in their homes. We have a lot of doctors right now, as I speak, isolating themselves. Some have recovered from the illness because the state has suppressed testing. And without testing, whatever effort they have made it. At the beginning of the pandemic, we commend the efforts that were being made on primary prevention. That means don't allow any case coming. But of course, with the porous, those efforts did not, despite the good intentions, we still had people still coming in, legally or illegally. And they were supposed to tune in into the second phase, which is secondary prevention, where you now have to test people early and prevent possible severe illnesses. And that is what they have refused to do. And we have gone the extra mile to ensure that we have that evidence to back up what we have been saying for weeks.
Hang on, Dr. Ayuk. Let me bring back Dr. Edu on this matter. Well, Dr. Edu, yes, much as they acknowledge the good works that the state has done at that point, but could you tell us what is the situation about those 5 cases which you just spoke about?
Okay, so it's really very sad that the NMA Cross River State is going on an indefinite strike to put the lives of Cross Riverians at risk for upload of results or no upload of results. First and foremost, we were not informed about any of this. They said they are an independent center, and they went ahead to send samples, which we do not know if they sent or they didn't send. We don't know anything about it. The claim is that samples was sent to Ebonyi State, and that they got results back from Ebonyi State. As a state, we do not have powers over Ebonyi State to announce anything from Ebonyi State or stuff like that. If we are brought into the picture, we don't mind if you're the one taking samples or if you're the one sending samples. But if you're brought into a picture, they are written public health procedures and responses that should take place for a sample to be verified and then, of course, moved from one point to the other, being transparent. There are verified principles that you must follow. Number one, you should be able to at least identify who the patient is. Secondly, you do a history taking, and then of course you write it down in the case finding forms. And then after that, you fill all the required forms. And if the person meets the criteria according to what NCDC have written, then you take samples, you issue to the person an ID number and then an EPIC number, and then you send these samples in a perfect situation. Of course, the jokester boards and all what is needed, the sample collection kits full, and then you send it to the lab where you can trust the integrity of that sample. The sample gets tested, and then the results are brought back, and then the results are uploaded. This is the normal public health response and procedure anywhere in the world. So I don't know why they would not want to go through that procedure, and then you declare a strike in the name of they did not upload your results. That's the reason to kill people in their numbers. That's the reason to
Just one moment, doctor. I don't know if you would agree that they have genuine concern, because according to a statement from the chief medical director of the University of Calabar Teaching Hospital, they said that those 5 samples returned positive and that they have duly informed the Cross River State government and other agencies of government. Are you saying you're not aware of this?
Okay, so up until this minute, no information was given to us except for a call by the CMD to myself, who said that 5 samples that they sent. We said, when did they send it, who, and all of that. We're not given that information. He said 5 samples that they sent returned positive. We said, okay, fine, great. Can we have this? And then we transferred names of 5 people, no phone number, no contact, nothing. I even spoke with the CMAC. I said, can we get at least the contact of this person so that at least we verify who they are, and then we can carry on with contact tracing while every other issue that should have followed a public health response is being sorted out. Every day in Cross River, we go on radio, we go on TV to announce to our people. I went through over 30 churches yesterday announcing that we have a testing center at the Lawrence Henshaw Memorial Hospital, which has been accredited by NCDC. You can
Understood.
come in and get tested.
Honorable Commissioner, that's understood, but I wonder if you're implying that maybe the NMA or the hospital are being deceitful in this sense, saying that there are 5 cases when there are none. But you recall that the NCDC DG said one time that, you know what, there is no state in Nigeria that does not have COVID-19. So do you still stand by that, that's your statement that Cross River State is COVID-19 free? Because for the NMA, there are at least 5 cases in Cross River.
I think we need to differentiate the issues here very clearly. For the last 7 days, our borders have been open since the 29th of June. People have come in here in their thousands. In fact, as at the last count, there were 2 trucks which the health workers at Garcom snapped with human beings from epicenter coming into the state. And they asked, should we block the state? I said, no, the federal government has declared that all the interstate borders are open. So let the people come in. We are expecting cases in their numbers. We are expecting people have traveled. I have relatives that have left Lagos and come to Calabar. We have people who have traveled from Abuja into Calabar. So having a case or not having a case is not an issue at all. And the Cross River State government is happy and ready to announce any case. All we're asking is that things be done the right way and let's be on the same table. That's just simply it. We've told them, please give us this contact of this person. Write a formal letter to us and stating that this is their name, their phone number, their address. We would immediately swing into action and go find out these people and all of that. That's just all we want. It's not too much to ask. It's a response. And so we must be as scientific as possible. We must be as clear as possible. We can't just deal on the air without knowing people. You just said me names and then we expect, and this was done just via a transfer over a social media app. And we're just expected to decipher who they are, where they are, and all of that. That's not fair. And then based on the fact that this has not been uploaded, you go on a strike. Would that be fair to the people of Cross River State who you have sworn to help? Whether it's uploaded today or tomorrow, the main point is that are people receiving care?
Just a minute. Let's bring back Dr. Ayuk on this one. Well, Dr. Ayuk, she says that at the moment that they're not aware of all of these cases, that there hasn't been any formal communication from the NMA to the state government. Is that the case?
Thank you very much. For respect for the office of the Commissioner for Health, I wouldn't want to join issues. We have tried as much as possible to be matured in the way we approach this matter. And it's very unfortunate. Yesterday, we were on a local radio program, Agba Jalingo program, and the Honorable Commissioner for Health said expressly that she has spoken with the patients that were, the contact tracing has started, that she has personally spoken with some of these patients. And now she's saying that contact numbers have not been sent to them. If I didn't know some of these patients, I would not join issues with her. But these are doctors, my members, who are currently recovering from COVID-19. There are people who live and work in Calabar. They are health workers. So I don't want to join issues with her. But what we are simply saying, which is very simple, and which is within, we have said that if what we are asking for is done within a few hours, we'll call a meeting the next, because we don't want Koreans to suffer for nothing. But what we are having is a deliberate attempt to suppress testing and to suppress confirmation of cases in Cross River State. For whatever reason, we don't know. I'll give you an example. One of the reasons why NCDC, where we're insisting on independent test status for UCTH, is that that's the only institution we trust that can do the right thing right now, because trust has been betrayed. We had over so many samples collected. For example, one of the sample test results that was given to one of the patients, I think the family requested for the result of the wife requested for the result of the late husband, for not to make his name public. I'll call him AB. And a test result was written, test sample was taken on the 15th of June, 2020. And the signed result, which was signed for the Commissioner for Health on behalf which was signed by the state epidemiologist for the Commissioner for Health, has this EPID number / unique case ID, NIE, CRS, CAL 20039. NIE is the national identification, CRS is Cross River State, CAL is Calabar, 20 is the year, that is 2020, and 039 is the serial number that started from 001, that is for Calabar. So from the evidence they are also producing to us, for this particular patient, as at 15th June, we had 39 samples being collected from Calabar itself. And if you check out the NCDC situation report, as at 30th June, we only have 8 samples being sent for PCR testing. This is a very unethical practice. With this alone, we have lost trust in the ability of the Cross River State government to handle the issue of testing in the state. All right. Because that is the bedrock of successful management of cases. Okay,
Dr. Ayuk, pardon me, we need to get her to respond directly to some of those concerns and claims that you just highlighted. Well, Dr. Dufers, he says that you did say yesterday that you had personally spoken to some of those persons and that the epidemiologist signed those documents on behalf of Cross River State government. So could you respond to those two cases? Because if the epidemiologist is aware,
okay, so that is completely false. Absolutely false. On the radio station yesterday, one of the names is a doctor who I know. And I have spoken to him on phone recently, I think about 3 or 4 days ago. And we had even attended a launch of our HIV SACA Global Fund project together. So he was the one who I reached across to. And he is the only person on that list who I know. The other names on that list, I cannot identify who they are. But without a formal letter, we went ahead to reach out to that doctor. Of course, when he says the epidemiology have signed any stuff like that, no single stuff have been signed by any epidemiologist. I'll ask him to put out whatever the epidemiologists have signed on these 5 persons in question and put it out for the world to see if such exists. Those
Dr.
are just falsehood, and I would not want to join issues.
What they're saying now is that Cross River State, by now, with all of this, ought to declare a COVID-19 positive case. Do you agree with that?
For goodness sake, we have started testing, and we are going to upload all our test results on the internet, and we will see the cases, those which are positive, those which are negative. They will all be up and out there. We have no business hiding anything. It's just a case of having people who have personal interest and are using a platform to project it. It's unfair to the people of Cross River State. It's unfair to them that for upload of a result, you go on strike to shut down all the doctors in Cross River State
For the upload of a result, he says he used the word deceit in the way Cross River State government is handling the cases.
There's absolutely no deceit in anything. All of these are just made up. For goodness sake, we have all our files, we have all our documents, we have all our evidence available, and we can put them across to any quarters that will require.
Is the state going to call a meeting? Is the state going to call a meeting with the NMA to iron this out?
Oh, definitely, we would call a meeting. We would invite them for a meeting. As soon as possible, we would invite them for a meeting. We've also invited even the national to come in and see what is going on in Cross River State. The governor of Cross River State has invited them based on the recommendation of the COVID-19 response team in Cross River State. So we're happy to have them come. It's a transparent process. We have all our documents. I'm happy to share.
Okay, let me get Dr. Ayuk's quickly concluding thought. Dr. Ayuk, she says that, well, the state is going to reach out to the NMA. Would you be going for that meeting now? What would you be requesting, if at all you will?
If they want to invite us for a meeting, let them first send the EPI numbers to the 5 samples that have been confirmed. Once they do that, I think we'll be willing to come to the table with them. That is the first condition. It's a very simple matter.
Okay. All right, I'm afraid we just need to end it at that point. Well, you heard both of them there, Dr. Betta Edu, Commissioner for Health, Cross River State, as well as Dr. Agam Ayuk, the chairman of the NMA, Cross River State. Thank you both for joining us today, and we hope that all of this is sorted. And the NCDC themselves, well, they did refer to NCDC a lot, so we're hoping that all of them will sort all of this out and not put anyone's life at risk.